So, with that as the context, like we'll talk for like 10, 15 minutes about women's
Yeah.
health because
Yeah.
like you alluded to it, like, so if you're not a woman, you probably know a woman and you probably need to support a woman, or you have a woman who supported you that you should also support. So this is kind
Yeah.
of for everybody. But what are some key things that you would lead with to talking to women about how their health needs
Yeah.
differ because of their
Totally.
biology?
So I used to be a foods and nutrition university professor at a university, and my class I got to teach was sports nutrition. What is so fascinating, because I've read more sports nutrition, like PubMed research articles, is most of the time they are conducted on young men in their 20s. So women's athletic bodies vary very much from that of males. And also, when you look at the yelling on the internet related to food advice, it's often the males that are the loudest, screaming, "This is the best, carnivore, keto, da 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 da." So women are absorbing this information that has been studied and tested mostly on young males. Women are often excluded from research studies because it's hard to control for their cycle. Because women have different hormones at different levels of the month, and science is trying to have things as even and as controlled as possible. So they're like, oh, that makes it difficult to figure out how they're going to respond to this training stimulus or whatever. Let's just leave them out. They're going to have those changes. That should be studied
So we
within the
couldn't
context.
we couldn't possibly baseline, like, what is your normal cycle duration? When does it start? What day did you like?
Well, your hormones are not going to be the same for a 28 to 35 day period. And
Oh,
that's normal for every
yeah.
single female of reproductive age. That's probably something we should study. So here are some of the noticeable differences that have come out from those researchers who value studying the data in women versus men. One big difference is fasting, and another big difference is carbohydrates.